Picture a world where just one therapy session could alleviate the symptoms of depression, PTSD, and even neurological conditions like Parkinson's and Alzheimer's. Sounds too good to be true? Think again. Science is now acknowledging and proving that psychedelic medicine is not only possible, but it's revolutionizing neuroscience in ways traditional treatments have failed to achieve. Stick with us as we explore the groundbreaking capability of psychedelics and how they are reshaping the future of neurological healthcare. Imagine this. Substances like psilocybin, the magic in mushrooms, LSD, and MDMA, long used for centuries in ancient healing rituals, are now being decoded by modern science, and what we're discovering is mind-blowing. These psychedelics don't just alter your consciousness temporarily, they target the brain's serotonin receptors, especially the 5-HT2A receptor, and unlock a process known as neuroplasticity, the brain's ability to rewire itself. This means that instead of just giving you a fleeting high, psychedelics are helping the brain form new connections, offering lasting relief from depression, anxiety, and even diseases like Alzheimer's and Parkinson's. The future of healing may be more profound than we ever imagined. One of the most groundbreaking studies in psychedelic research comes from psilocybin-assisted therapy for treatment-resistant depression. Traditional antidepressants can take weeks to work and may not be effective for everyone, but with just 1 or 2 guided psychedelic sessions, patients have reported significant reductions in depressive symptoms that can last for months. The secret behind this? Psychedelics like psilocybin, a compound found in certain mushrooms, allow the brain to break free from rigid negative thought patterns, offering a reset for mental health. Psilocybin-assisted therapy has shown promise in treating depression, with a study predicting that it could aid 56% to 62% of depression patients, underscoring its potential as a widespread treatment option. Research from Johns Hopkins Medicine further demonstrated that psilocybin treatment led to significant decreases in depression severity, with effects lasting up to a year for most patients. Check out the old movie Altered States to see how far we've advanced, and let us know your thoughts. Number 3. Psychedelics in treating PTSD and anxiety. For those battling PTSD, psychedelics could hold the key to unlocking deep emotional healing. MDMA, often called ecstasy, is proving to be a game-changer in treating post-traumatic stress disorder. In clinical trials, patients who underwent MDMA-assisted therapy experienced striking improvements, with many no longer meeting the criteria for PTSD after just a few sessions. This powerful effect happens because MDMA enhances emotional openness while calming fear responses, giving patients the ability to confront and process traumatic memories without feeling overwhelmed. The results are nothing short of transformative. For some parts of the US, such as the San Francisco Bay Area, therapists are utilizing MDMA-assisted therapy to treat trauma, PTSD, addiction, and chronic pain, particularly among older adults. Clinical trials at institutions like UC Berkeley and UCSF have revealed positive outcomes, suggesting that psychedelics can address mental health issues more swiftly than traditional methods. Here is a list of psychedelic treatments, some of which have already been approved. The FDA has approved Johnson & Johnson's ketamine-derived nasal spray, Spravato, as a standalone treatment for adults with major depressive disorder who have not responded to at least 2 oral antidepressants. This approval offers hope for patients seeking rapid relief from depression symptoms. Imagine a world where a simple, smile-inducing gas could lift your mood. Well, that's what a study led by Professor Peter Nagel at the University of Chicago discovered. Low doses of nitrous oxide, commonly known as laughing gas, have shown to be incredibly effective in treating treatment-resistant depression. It works by activating neurons tied to mood regulation, bringing rapid improvements that can last up to 2 weeks without the usual side effects. Who knew that a little laughter could be so good for your mental health? Ibogaine, a lesser-known psychedelic, has also been studied for its potential in treating PTSD. A small trial involving military veterans indicated that ibogaine could significantly decrease PTSD and depression symptoms, with participants reporting an average reduction of over 80% in symptoms 1 month post-treatment. For PTSD patients, the therapeutic use of ayahuasca is often seen as a way to reset the brain's response to trauma. The brew's psychoactive effects help people confront their trauma in a profound way, which may lead to long-lasting emotional healing. Unlike traditional talk therapy, which can take a long time to process traumatic memories, ayahuasca is thought to offer a shortcut by inducing a powerful, altered state of consciousness where individuals may directly confront the emotions tied to their trauma. Psilocybin is developing CYB003, a deuterated analog of psilocybin, aiming to provide improved pharmacokinetic properties, including reduced variability in circulating levels and a faster onset of action. As of October 2024, CYB003 is in Phase 3 clinical trials for major depressive disorder. Beyond mental health, psychedelics are now being studied for their potential in treating neurological disorders. Research suggests that psilocybin can reduce inflammation and promote neurogenesis, the growth of new brain cells. For diseases like Parkinson's, where dopamine-producing neurons are lost, psychedelics could help slow disease progression and improve motor function. In Alzheimer's, psychedelics might enhance cognition and reduce anxiety related to memory loss, offering patients a better quality of life. Beyond mental health, psychedelics are gaining attention for their potential to treat a range of neurological disorders. Emerging research suggests that psilocybin, in particular, can reduce inflammation in the brain and promote neurogenesis, the growth of new neurons. This holds promise for conditions like Parkinson's disease, where the loss of dopamine-producing neurons leads to motor dysfunction. Psychedelics could potentially help slow disease progression, improve motor function, and even enhance mood. In Alzheimer's disease, psilocybin and other psychedelics may offer cognitive benefits, reduce anxiety associated with memory loss, and improve overall quality of life for patients. Additionally, studies have shown that psychedelics could support neuroplasticity, helping the brain adapt and repair itself, which is particularly valuable in neurodegenerative diseases. As research progresses, psychedelics may become a transformative tool in the treatment of these debilitating disorders, offering hope for new therapeutic avenues. Despite their powerful potential, psychedelics are still shrouded in controversy thanks to their history as illegal substances. But things are changing fast. The FDA has just granted breakthrough therapy status to psilocybin and MDMA for mental health treatment, and clinical trials are advancing at lightning speed. Countries like Canada and even parts of the US are already decriminalizing psychedelics for medical use. The real question isn't if psychedelics will become mainstream medicine, it's when. It's crucial to remember that psychedelics aren't quick fixes or magic pills. Their effects are deeply influenced by set and setting, a person's mindset, and the environment in which they are used. This is why research emphasizes the importance of guided therapy sessions with trained professionals to ensure both safety and effectiveness. For centuries, in countries like Brazil, psychedelics have been recognized as powerful tools to mend the mind and heal broken hearts, deeply rooted in traditional healing practices. When used responsibly, psychedelics have the potential to revolutionize mental and neurological health care. The world of medicine is experiencing a revolution, and psychedelics are at the forefront, breaking new ground in ways some never thought possible. From treating depression and PTSD to potentially reversing neurodegenerative diseases, the future of healthcare is brighter than ever. But here's the big question: should psychedelics become mainstream medicine? We want to hear your thoughts. Drop a comment below. And if this video has opened your eyes to the future of medicine, don't forget to like, subscribe, and hit that notification bell so you don't miss our upcoming deep dives into more game-changing breakthroughs. Plus, stay tuned for our next episode where we'll focus solely on ayahuasca. Trust us, you won't want to miss it. Thanks for watching, and we'll see you in the next one.